All right, few minutes after 7 o'clock. Thank you everybody for joining us on this town hall. We have myself, Mr. Rice, and Leslie Kuhn, our district in charge of our district, our total district, Silver Falls district nurse that's working round the clock, and really appreciate her being here with us today. So I'll let her introduce herself. Real briefly, I'll do some updates and then we'll hand it back to Leslie. You have a presentation for us that's going to be extremely informative and helpful for all of us. So why don't you introduce yourself real quick, and then I'll do a update, and so will Rise.
Thank you, Sione. Yes, as you mentioned, I'm Leslie Kuhn, and thanks for joining us, everybody. But I am one of the school nurse consultants for Silver Falls School District. And I am helping to take on the COVID-19 health and safety protocols for the district. So I am excited to be here tonight, and I'm happy that you could join us. Thank you.
Thank you so much. So I'm toggling back and forth. Hopefully I did it correctly, and I got Ms. Drescher here as a panelist. Hey, Jody, thanks for joining us. Okay, we'll see if she gets on here. So we'll go through a few updates and a couple questions, and then we'll hand it over to Leslie so you can please share with us you have a presentation and you'll be sharing your screen as well. Sure.
I think I'm already sharing my screen, or am I not?
Yes, I see it.
Okay. Okay. Do you want me to unshare my screen, Sione?
No, okay. Leave it right there. We're good. We'll go real quick. So a lot of questions that we had over the past week, and we did share that we will be sharing some of the information of data that we've gotten with the COVID positive cases, along with the quarantine. I'm here to update you that we as a district are not there yet. We're looking into the capacity and the resources in which we'll be able to start to post that information. But right now, what we're doing is we're focusing diligently on our resources right now, including Leslie, to ensure that we do proper contact tracing, and we're doing proper notification for the individuals that are being identified as close contacts and positive cases. So our focus is right now on the individual communication piece. Not at the moment, not right now. We're not at the point to have a dashboard district-wide or schools to have that information posted. So we're not there yet. It's not a no, it's just coming soon. We're still working on it. So I just wanted to update on that. We have a lot of activities and sports and events that are occurring. We'll ask Mr. Rice to do a brief update on where we're at and where we're going.
Absolutely. Thank you. First of all of those that are joining us tonight, we appreciate you being here and giving us another opportunity to try to share out some information. On the good news side of things, we do have plenty of athletics and activities continuing forward into as we head into the regular season. Tonight we have our volleyball program is actually hosting Crescent Valley tonight. So that's actually why we don't see Mr. Patrick Mulligan on the call. He's our admin in charge of that event tonight. So we have volleyball at home tonight. And then we actually have, we are hosting our second home football game tomorrow night. That again will be starting at 7 o'clock. Gates will open at 6. We will be against South Albany tomorrow night. Our cross country folks are headed down to another event this weekend down in Eugene at Lane Community College. So we have plenty of events going on, which is the good side of things. I don't want to sugarcoat things and share that we also have not had some shutdowns as well. And just a little bit of info from my standpoint with that. You know, when we were in the summer and we weren't quite back to school yet, a majority of our exposures or potential exposures, I guess, came from our practices and transportation and games. And while that is still obviously potential time for exposure, obviously getting back into the school is an increased situation. And so the one thing that I did want to share tonight, we've made the decision that going forward, that even though there may be a potential exposure that happens in a practice or in a game or in an athletic or activity situation, we obviously have to run our contact tracing through the school day as well. And so when we make those exposure notifications to families, for right now, we are hoping that Mr. Thompson will be able to share that information through email. So if you receive an email from Mr. Thompson that says your child has been exposed, please, please, please be aware of those dates in which your student would be in quarantine. Again, with as much going on, it does take us a little bit of time to work through those lists and to work through those potential exposure situations. So please be as patient as you can. We will get that information out as quickly as we can. Again, for those that have not heard this from me, once we have a potential exposure, usually the first person that we contact is Ms. Kuhn. That's why she's on this call tonight, so she can share some of that. And then she involves our health department. And so between our administrative team, our nursing team, and the health department, we basically make a plan, and then we have a plan to go ahead in terms of communication. Again, each step takes some time, and so we will get that information out as soon as we can. But please, if you do get the email that says your student was exposed or potentially exposed and they are in quarantine, please hold them out from school until that date to return is met. The only person that can really, or the only place that can take you off of that quarantine list is from the health department. I know that Leslie's going to talk a little bit more about that, but just kind of wanted to share that there are a lot of moving parts. We try to work as quickly as we can, but we also want to make sure that we are thorough to try to minimize what we can. So again, thanks for being on the call tonight. Any athletic specific questions, please feel free to reach out by email or by phone. Thank you.
Guys, and to kind of go further into what Mr. Rice was saying is if that in the case that you have a student that is out needing quarantine, we want to make sure that we still have access to one's education. And through Canvas, we're hoping to upload as much information from your students' classes. And if you're having trouble, then be sure to email directly to your teachers, your student teachers. And as you go through that process, if you're still having trouble and there's still some items that you may, or materials that you may need on campus, go ahead and call the front office and we'll help and assist you to make sure that we can have things packaged if you need to pick it up or if you need packaged material that is required from your teachers. So on an individual basis, we'll be sure to make sure that we have Canvas and contacting you via email, call the front office if we need to pick up packets of material as well. So just wanted to make sure that we knew that. We'll go through some of the questions. And so Leslie, this is a question for you, but you can just think about it and go through this with you through your presentation. But one of the questions I thought was great is what can parents do to support the nursing staff through COVID? So maybe you might already kind of touch up on that through your presentation. I think Ms. Drescher, you can kind of share a little bit more of the information about our gaiters and bandanas allowable for our students on our campus. So you can touch up on that a little bit, Ms. Drescher.
Yes, so we're going to own totally that we've had some miscommunications and out there through this first 2 weeks, but what we need to be clear about, and we're going to send it out in a flyer, as it were, I guess, but gaiters are okay if they are 2-ply, not a gaiter that's folded over though. It has to be a 2-ply gaiter. That would be okay. Bandanas are not okay because they're loose down there. Even if they try to tuck them in, bandanas are not okay. So other face coverings are medical grade masks. Masks are considered medical grade, as it were. And then there's also fabric masks. Mesh masks are not okay, or anything else that is not, has holes in it. Those things won't be acceptable. And we will send that out tomorrow so that people can get their ducks in a row and be ready to go next week.
Thank you so much. We have another question it's around, is the school conducting COVID screening? So we do have the ability to do a COVID screening, but that would only be in the cases where there are students that are symptomatic or showing symptoms, and we would not conduct a COVID test on a student without parental consent, which includes parental signature on that. So just to ensure and be clear, we do have the ability, but we would not do that without consent.
And not to interrupt, but I will go over that in my presentation along with face masks, a little bit more information about the testing versus screening options we have.
Perfect. Thank you. Thank you so much. So that'll be covered in more detailed. There was how can students or anyone make a complaint or address a concern anonymously? So on our school website, under quick links, there is a section that you'll see. It says Safe Oregon Tip Line. That has been up there, and at any time that may be used to voice a concern or potential complaint. So again, that is on our website under quick links, under the link called Safe Oregon Tip Line.
And Sione, if I could jump in there too. One of the other things too, if students see something that's not okay, can assure them, there's 1,300 kids that walk through our hallways. If you come and talk to one of us as an adult, we keep your name out of it. And that's what we intend. That's what we always do. So we want to assure you, you have that option too.
And I will add that I have an update about that in my presentation too, that we're getting that going, an anonymous concern line district-wide.
Oh, that's even better.
Sorry.
I think most of these will be answered. So we'll do one more question that I see. Are outdoor tables for lunch still on order? We want to share with you that we are in the process of ordering and en route with more tables, more seating, along with tented space outside in the courtyard. So hopefully that we'll have that shortly. We've been working with our facilities and maintenance crew to ensure that we can secure the benches, the tables, and the tents. Mr. Rise, he's kind of pointing on this. You have anything else to add on that front?
Just that we do have some table space and outdoor space that is being used regularly. Yes, we want to add more, but we have a good group of kids. I think the nice weather has allowed that to be an easy access. I think once the weather starts to turn, the tents that we get up here in the next week or so, I think will continue to be a place for us students to be. But students are accessing space outdoors at this time. Those that want to be outside can, and we have plenty of folks that eat outside.
And there's another question regarding heaters to go with the tents. That is something that we are also looking at, because having them is great, but we have to be able to store them overnight and on weekends as well. So we have to look into that and what the parameters we are around that so that we make sure we follow all the rules with a public school building.
Guys. So the set of questions that I'm looking at, I'm thinking that they're going to mostly be answered by Leslie in her presentation. So without further ado, want to thank you, Leslie, again. And we know how swamped you are, and you've been extremely diligent in working with the entire staff across our entire district. So I'm going to throw it over to you. Thank you. Go ahead, take it away.
Thanks, Sione. Thank you so much. So yeah, I'll just go ahead and get started here. I kind of have a robust presentation for you all, but I'm going to review some recent information regarding COVID-19 in our community, and then highlight the health and safety protocols that you can expect to see at Silverton High School and a lot of our other school buildings this school year. So there's multiple proven measures that we can use to prevent the spread of COVID-19 in our schools and communities. And our goal, as you know, is to keep our students in person 5 days a week. With the current COVID-19 surge, it is critical that we layer these mitigation measures to attain this goal. So I want to start off by sharing the most recent daily update on the Oregon Health Authority's website. When I say OHA tonight, that is referring to Oregon Health Authority. But this chart is from the daily update from 2 days ago on the 14th and shows the increase in case numbers in the past month. 2,069 cases were reported on this day with 46 new deaths. And to put that into a little more perspective, July 19th had a reported 585 new cases. So, I mean, everyone's aware our cases we're in a surge, of course. Our increase in case counts and deaths are related to the variants that are circulating in our community, along with low vaccination rates, and then also lax prevention measures in place as well. And then looking a little more locally, this table summarizes metric data for Marion County and also includes Silverton specific data. On the left of the table are the metrics that were followed closely last school year per RSSL to help school districts determine what learning platform was the safest based on the community transmission in the area. In this table, you can see the latest set of metrics for Marion County, Clackamas County, and Silverton. It's another stark reminder of how high our community spread is of COVID-19 and why it's so essential that we follow the health and safety protocols that have been proven to help mitigate the spread. When there are such high numbers of illness at one time, that puts a tremendous strain on our hospitals, medical resources, and healthcare providers. Our current surge is beyond any surge we've experienced so far during this pandemic. And as you can see in this graph taken from OHA's hospital capacity dashboard, in our 6-county region, which includes Benton, Lincoln, Lynn, Marion, Polk, and Yamhill counties, there were only 3 staffed ICU beds and 29 staffed non-ICU beds available for patients yesterday, September 15th. So our hospital capacities are diminishing, which is a significant concern for those needing medical care, COVID-19 related and non-COVID-19 related. Early in the pandemic, you heard a lot about flattening the curve to prevent this exact scenario our healthcare system is currently facing. I'm just kind of bouncing around here at just some different dashboards that OHA shares, but looking at our pediatric population, which includes ages under 18, they account for 13.4% of all positive cases in Oregon. This has risen from, I think it was about 10% last school year. This is as of yesterday. Hospitalizations remain rare in this age group, but hospitalization rates for ages 0 to 5 have shown a large increase since August. There's been 4 pediatric deaths related to COVID-19 reported to OHA in Oregon, and also 40 cases of multi-system inflammatory syndrome in children, which is the MISC, which is a condition that can occur from COVID-19 infection where different body parts can become severely inflamed. So as I mentioned, most illnesses in this age group are not severe. However, there is the risk of severe illness still or having long-term COVID-19 symptoms. Long-term COVID-19 symptoms, also known as like a long hauler or long haul COVID. Some studies have shown that that occurs in 25 to 33% of those with COVID-19 infections. And if you want more information about that, you can, I can send it to you after the presentation. So this slide is a nice summary about our variants of COVID-19. So viruses generally mutate over time, creating new variants. The virus mutates approximately every 14 days, and the more it is spread, the greater the ability it has to continue mutating. Variants are discovered by the specific sequencing of test samples that have been collected. This slide is a nice visual showing the virus's mutations and variants in Oregon. As you can see here, it is clear that the Delta variant, which is the yellow, is the predominant variant in Oregon. In the week of August 29th, 100% of the 33 samples that were sequenced for variants were the Delta variant. The Delta variant is more contagious in that one person can spread it to 5 to 9 people, and it has significantly higher viral loads. We've seen more severe illness than previous strains, and it is potentially less responsive to the medical treatments used for the original strain of COVID-19. Shifting to vaccines now, we're definitely seeing more people that are fully vaccinated testing positive. This is called a breakthrough case. A large reason for this is because of the Delta variant. Per the CDC, the Center for Disease Control, the mRNA vaccines do have a lowered effectiveness to the Delta variant when it comes to testing positive, in which it drops from 92% effectiveness to 79% effectiveness, and also a lowered effectiveness of having symptomatic infection. So it drops from 93% effectiveness to 88% effectiveness, and that's with the Delta variant. In the week of August 24th to September 4th, 19.3% of positive cases in Oregon were breakthrough cases. So almost 20% of Oregon's cases were in fully vaccinated people. Of those to date, 4.9% of all known breakthrough cases have been hospitalized, and only 0.9% of those have died. So even though we're seeing breakthrough cases, it is evident that the vaccines are still effective in preventing infection and serious illness, including hospitalization and death. And then the last little dashboard I wanted to share is, this is the new dashboard that has been supplied by ODE, Oregon Department of Education, and is linked on our website now. This gives a snapshot of county information regarding COVID-19. Again, Oregon Health Authority COVID-19 page also has very informative dashboards as well that you could follow if you wanted to. You can see the vaccination rate there for Marion County is 56.7%, and the zip code 97381, our zip code vaccination rate is similar to that at 56.8%. Okay, so that was a little summary of what it looks like right now in Oregon and Marion County. So let's dive into what are we doing in our buildings to keep our students and staff as safe as possible and in person 5 days a week. So first, we follow requirements and guidance from both Oregon Department of Education and OHA. In addition, we have a strong relationship with our local health department, Marion County Health and Human Services, and we must follow their guidance they provide. Our district is also following our county and city metric data weekly, as I shared with you, as well as the pediatric specific data provided by OHA, just keeping an eye on that. I am going to skip the basics of COVID-19 because I assume you're all well versed in that by now, and instead move forward with the health and safety protocols. So here's a snapshot of evidence-based key practices for reducing the spread of COVID-19 in our schools. Some of these things are required this year by ODE and OHA, and others are strongly recommended. We are continuing our efforts from last school year and continuously strengthening our protocols as we discover weaknesses. So I just want to reiterate that it's week 2 and we've already learned many things and noted many areas of improvement that are needed. And so working on improving those processes. That's our main goal. The first health and safety protocol is wearing face coverings. So masks remain a simple but powerful tool to protect against COVID-19 and prevent the spread of the virus. They are required for all staff, students, and essential volunteers and visitors while indoors, with the exception of during meals, playing specific musical instruments where you have to breathe into it, and also when playing a competitive extracurricular sport. Face coverings are required for all individuals when outdoors if they cannot consistently maintain 6 feet of distance from others. For PE, since PE is a class and not itself a competitive sport, face coverings are required during this time. Silver Falls School District is requiring families and staff to follow CDC recommendations for masks, which includes the following. Masks should completely cover the nose and mouth and fit snugly against the sides of their face without gaps. They should have 2 or more layers of breathable, washable, solid fabric. They're recommended to have a nose wire to prevent air from leaking out at the nose. This was already mentioned a little bit, but face masks that are not acceptable include masks that are made of lace, mesh, sequins, or a single layer. Masks with vents or exhalation valves are not acceptable either. Bandanas and gaiters that are only 1 layer. So each school has a plentiful supply of masks for students and staff that need one. And I also want to add that group mask breaks can occur as long as 6 feet distancing is maintained, and it is preferred to do this outside. I don't know if they are doing that at the high school at this time, but especially in our elementary grades. So more COVID-19 health protocols is the first one is physical distancing. So students are encouraged to maintain at least 3 feet from each other throughout the school day. As much as possible, desks are separated at 3 feet or more. Staff must remain 6 feet of distance from students and each other. Silverton High School has floor markings and visuals to help remind students and staff of this in the hallways, at transition points, and in classrooms. Another health and safety protocol is hand hygiene. Hand washing will be required at specific intervals during the school day, including upon arrival and before and after lunch. There are hand sanitizer stations dispersed throughout the building. Ventilation is next. HEPA filtration devices have been placed in all areas that were found to have inadequate ventilation per our maintenance department's assessments. In addition, classrooms are encouraged to increase ventilation by opening windows and doors as long as it doesn't pose a safety risk, and also to do outside learning as much as possible. Last on this slide is cleaning and disinfection. So our schools follow our maintenance department's cleaning and disinfection protocols for daily routines and specific protocols for positive cases and exposures. So this next protocol is essential in helping us keep sick students home. I do want to say that staff have a version of this as well, that they are required to go through every day and attest that they have no symptoms or exposure when they arrive to work. So back to the student screening. You should have received a letter from the high school that includes this flow chart. If you didn't, please reach out and we'll get you one. But please refer to this flow chart every day before sending your student to school. If your student has any of the listed primary symptoms, which includes cough, fever, chills, shortness of breath, difficulty breathing, or a new loss of taste or smell, or if they've been exposed, please keep them home and notify the high school. One other thing is that if the student or a family member has been tested for COVID-19 and is waiting for those results, please stay home until those results are known. Nursing will be following up with you as soon as they can to help you determine next steps. Another piece here is that if your child becomes ill at school, they will need to go home. So please have a plan in place to be able to come pick up your student in case this happens. We follow isolation and quarantine guidance from ODE and OHA and our local health department for each scenario, including students and staff with primary symptoms, positive tests, or exposures to COVID-19. So diving into the isolation and quarantine protocols a little bit, this is just a summary of some of the protocols, and I'm just going to kind of go through them to give everybody a good idea of what to expect. If your student is exhibiting a primary symptom of COVID-19, it is looking like a 10-day school exclusion starting on the day that primary symptom started. Or if they test negative, they can return to school once fever-free for 24 hours without the use of fever-reducing medication and symptoms are improving. We will need to see a proof of that negative test result. If your student tests positive or is considered presumptive means having been exposed to someone with COVID-19 in the past 14 days and becoming symptomatic with cough, fever, shortness of breath, or a new loss of taste or smell. That's what presumptive means. So if that's the case for your student, they need to isolate at home for 10 days since onset of symptoms, or positive test date if they have no symptoms. If your student is exposed to someone with COVID-19, this is looking like a 10-day school exclusion starting on last date of contact with that person. If this is someone in the household, the time may have to be extended since they are unable to separate from that COVID-19 contact. And nursing will talk to you about and will help you navigate that. And you'll notice that I'm saying, I just want to get this out, you'll notice that I'm saying school exclusion because quarantine is a term for the health department and stay at home school exclusion is a term that we can use. Marion County Health Department is not offering the option for testing negative on day 5 and ending quarantine on day 7. They are enforcing a strict 10-day quarantine at this time. If your student had COVID-19 90 days before this new exposure, you can request a letter from the health department to lift the quarantine. The health department does need to be able to track that result though, in order to give you that letter. So if you do contact us with that information that your student had COVID-19 in the last 90 days, we are going to request that you follow up with the health department, and it will be there in the notification for you, that phone number, for you to request that letter. At this time, the current guidance from OHA, ODE, and our health department is that fully vaccinated individuals are not required to quarantine if they've been exposed, but they're recommended to get tested 3 to 5 days after exposure date. I do want you to know that with the increase in breakthrough cases we are seeing, I have communicated my concerns about this guidance with the health department, and we will let you know if that guidance does change. So moving on to contact tracing procedures, I wanted to share with you a little bit about how we are currently tackling contact tracing procedures. An exposure is defined as a susceptible individual who has close contact for longer than 15 cumulative minutes in a day with a person who has COVID-19, with or without a mask on. So that is what a close contact, what the definition is of that. So nursing collaborates with the building administrator to help determine close contacts in the event a person who tested positive or is considered presumptive was on site while infectious. And that period is defined as 2 days before that person's symptoms started or 2 days before their positive test result if they had no symptoms. Nursing will then consult with the health department regarding our investigation to get guidance and recommendations. So during the contact tracing procedures, nursing and building administrators use the following to gather their information. We use objective data, including attendance records, seating charts, building and classroom logs. And we also use subjective data, including staff and teacher report during interviews with them, as well as the report from the positive person of who their close contacts were. Some questions we asked to help us determine close contacts, and these are guided by the requirements and definition of a close contact, are: were they within 3 feet of anyone for cumulative 15 minutes or more with masks on? This is for students. Or were they within 6 feet of anyone for cumulative 15 minutes or more without masks on? This is also for students and staff. Were they within 6 feet of staff for cumulative 15 minutes or more with masks on? We consider PE time, lunch time, one-to-one time with assistants, group work, and then of course sports. So if a school cannot confirm that 6 feet of distancing was consistently maintained, or 3 feet distancing with consistent mask use was not maintained or was maintained during the school day, then each person that confirmed case was in contact with will need to quarantine. And this could include all members of a stable cohort, unfortunately. So if I'm just going to leave it at that. And then we're going to go to the next slide. And if there's more questions about that, we can revisit it. This is a ODE visual talking about that 3 feet with masks on. So I wanted to share it. So when the students are at least 3 feet apart and everyone is wearing a face covering, as seen in the top left, students who are in close contact with someone with COVID-19 do not need to quarantine unless they have symptoms. Moving to the top right, if you take those masks off, students in close contact to someone with COVID-19 will need to quarantine and miss school days. So this is only for students. That 6 feet rule has been moved to 3 feet as long as masks are being worn. This does not apply to staff with each other or staff with students. It's still 6 feet when staff are involved. So this is a little bit of information about our communications flow chart that we follow for each case. I feel like if you know what our flow charts are, it might help to understand how we navigate all these scenarios. So once a staff or student has reported symptoms, an exposure, or has been confirmed positive or presumptive, nursing's alerted. This can be from staff or from the health department. Nursing then calls the student's contact or the staff member to confirm details of that report and to gather information. We refer to the Planning for COVID-19 Scenarios in Schools document from ODE and OHA, and we also consult with our Marion County Health Department. We provide guidance regarding isolation, quarantine, or symptom monitoring, which I've already mentioned. If needed, nursing will begin case investigation and contact tracing by the means that I told you before, by the avenues I reviewed. And then we consult with the health department on these positive cases and each scenario that requires quarantined individuals. Nursing then summarizes all the pertinent details of the scenario and guidance to provide an update to only necessary staff at the school, including the building principal, or if it's staff, then their supervisor and HR. The bottom portion of the flow chart, it's so big that it doesn't fit on one slide. Those identified as close contacts will be notified within 24 hours of the report. In the event a student or staff member is COVID-19 positive, all building staff will be notified, including a description of how the school is responding, and this is per OSHA requirements. If the student or staff member who's COVID-19 positive was in the building during their infectious period, all student families of the building will receive this notification. So lots of details around these notifications. Of course, maintaining confidentiality and following FERPA and HIPAA guidelines remains critical to ensuring our student and staff's privacy is respected. Only required staff will be included on communications regarding a scenario, and no personal identifying information will be disclosed on notifications sent to families and staff. So moving on, here's some information on COVID-19 testing. We do currently have Binax Now rapid tests that are available for, these are our diagnostic tests. They are available for students or staff that develop symptoms while at school, and students or staff that report having been exposed and are still on site. So that is when we would use the Binax Now rapid tests. Consents are required for those. If they are younger than 15 years of age, we need written parental consent. There is a consent, a minor 15 years of age or older may consent on their own to COVID-19 testing. So we have both consents. These are self-administered by the student with staff observation, and they do have to go home after testing, even if the result is negative. The other kind of testing that we are working on right now, it's in the works, is the saliva direct PCR tests. And this is through a partnership with Sandy M Hospital as part of the OHA weekly free screening program for students. Our goal is to start the first week of October to launch this and get our test kits out to students that want to participate. It is optional. It would require parental consent. And as I mentioned, it includes weekly free testing kits that would be picked up and dropped off at the school. And then results would be sent to the student or the parent via an app. So we're really excited to get that going. This is another hot topic. We know that being kept informed is important to you. So as I mentioned earlier, you should have received a letter from the school that includes information, including that daily screening flow chart, what to expect, and a list of health and safety questions and answers regarding COVID-19. Please expect routine communication from your school throughout the year regarding COVID-19 reminders and information. Our goal is to really stay connected with our community during this and improve our processes as much as possible and keep up on that communication. As I mentioned before, you will be notified if there's been a positive COVID-19 case at SHS. If that COVID positive case was infectious while on site. And again, if your student was identified as exposed, you will be notified directly about that as well. Finally, we plan to keep our district website up to date with COVID-19 specific information. You will find our communicable disease management plan there, county and city specific data metrics, COVID-19 specific resources, which is still in progress. And as I mentioned before, we plan to provide an anonymous concerns form soon. And then I know Sione did talk a little bit about the building specific case counts and quarantine counts dashboard. That is currently on hold for multiple reasons, including lacking the ability to create it and manage it at this time. But we are watching closely what other school districts are doing with this, and we'll reassess our capacity and ability as more information comes out. So that is all I have. Thank you so much for listening to me talk about COVID-19 for so long, and for all of your help in preventing the spread of COVID-19, which helps to keep our students in school 5 days a week. And so we can open it up to questions, or if there are any questions that didn't get answered in that presentation. Sione?
Yeah, well, thank you so much. That's a lot of information, and we'll again try to make as much of these slides and as much of the information public facing, so we can take a version of what you had shared with us this evening and send it out or post it for public consumption. So thank you. We also have a few questions that maybe you could help us with, and if you don't have the answers, Leslie, maybe you can take it down and get back to us in maybe an FAQ or something like that. But one of them was, are home tests adequate for testing and evidence or proof to return to school, I'm assuming? Or do you have any advice about what the best practice is for COVID testing?
So the home tests, I believe, are accurate. I mean, the health department is accepting home test results. Well, they said it was okay for us to accept home test results, basically. So I don't know too much of the specifics about that. I mean, it's not a PCR test, but I have heard that they are accurate. If anything, I mean, I know people are pretty concerned about getting a false positive, but it's more likely to get a false negative, of course. If you do a rapid test too soon in your symptoms, then it could be false negative. So it's really recommended to test, at least 24 hours after your symptoms start. I'm not an expert on testing, to be honest, but yeah, that's what I have for that.
No, I think that's great. Also, we've ordered pallets of Oxifer wipes that we provide to our classes and to our students, and many of our students and many of our teachers do a diligent job in wiping table surface before and after usage. Could you share with us any knowledge that you have, Leslie, of if maybe some of my sinuses or my eyes, or I have some redness or irritability because of using these? Do you have any advice as to maybe what products we could use that would still be effective? And do you have any idea of what the cleaning agents are in what we provide at schools through this?
I believe it's hydrogen peroxide based is my memory of it. That would be a great question for our maintenance department, who has kind of taken on the cleaning and disinfecting. But I do have links to, CDC recommendations of EPA approved cleaning and disinfecting, items. So I can definitely look at that, and we can work together on an option that isn't creating effects for people.
Sure.
Also,
what
we
can we
provide
use?
gloves as well.
What could we use if we do find that one person is having some effects? What else could we use that maybe the school can go out and provide?
Yeah, so we can look at that list, the EPA approved list, to see if we can find something that is just a different product. Basically, you know, maybe it's just that product based, but I do think it is hydrogen peroxide based, which is usually the least toxic of all of them, unfortunately. So maybe it's something where that student should just not be touching those, or we provide gloves. Yeah, those are kind of my ideas.
That helps. Perfect. Thank you a lot. You know, I think that might be it. We'll wait for a few more questions that come in. I do have a question regarding, can a student exclude themselves from a class or an environment in the building where they feel that they are unsafe? And I'll ask Jody and Rise, James, to chime in on this, but at any given point in time, if a student feels uncomfortable with the surroundings, us as adults, all of our teachers, we're being as diligent as possible with separating students, especially during passing. And in some instances, we do know that separating to 6 feet is very, very difficult. Maintaining 3 feet is also somewhat difficult, but we're constantly reiterating this. And if a student feels that they need to take themselves out of that space and that time, by all means, absolutely, they can come down to the main office and we'll help them out. So I'm not sure.
Or perhaps
Jody,
go to their counselor would be my first suggestion, because that might be a little less intimidating for them, that they might try, go to the counselor would reach out to us from there. So I would suggest the counseling office first.
Perfect. Thank you, Jody. All right. Does anybody know if we have vaccination dates? I think I saw October. I will check our calendar. Does anybody know, James, Leslie, or Jody, our next vaccination that will be hosted at the school?
I'm not aware, I'm sorry.
I'm not aware of anything either. I think the vaccination you're talking about is the flu vaccine. I don't know that it's a COVID one. I haven't been in discussions with anybody about that, about setting that up.
Nothing on the schedule as of yet, but we'll look into the near future. And if anything comes up, we will post it. All right. Okay, we see any other questions on there, Mr. Rise?
Well, there's a question about, will all schools be notified of what are appropriate masking choices? We work hard to try to be consistent, but I understand that when we have this many different buildings, we can be inconsistent. So what I can offer is this: what I send out to you guys tomorrow, I can share with the other schools as well, because we share things back and forth all the time anyway. So I can offer that out.
It was brought up that was a big concern this week. And so it was a project that we are currently doing, and we will get consistent communication out to all schools. As Jody mentioned, like just a flyer to summarize SFSD's district-wide policy on masks in alignment with CDC recommendations, which is this. So it's just like a one-pager that can be sent to families or referenced by building principals and staff.
Thank you. I think we have some very, very positive folks out there that want to assist. So Leslie, when we go through our process and trying to figure out what we need, is it possible that we let and notify our families of some of the resources that we may need in order to get a dashboard or a public facing count out there for them. So that seems to be one of the more frequent questions that we're receiving over the last couple of days. So whatever resources you think that you need, and maybe we could put some kind of shot out there on our parent square to see what we can gather.
I really appreciate that. And I did just reach out to our state school nurse consultant last night asking for why isn't there just like a some type of program that can just help us plug this in and help us manage this. And she probably, didn't know what to take of that message, but I really appreciate that offer. And I think it's a great idea to find strengths in our community that we might be lacking in ability. So that's great. Thank you.
Thank you. Well, we're approaching 8 o'clock. It's 7:53. We just want to thank you, Leslie, for sharing all of that great information. A lot of that information is digestible and readable publicly in the communicable disease plan. But like me, a lot of times in reading it, I need someone to break it down like how you broke it down for us this evening. So thank you so much for making that make sense to all of us. Really appreciate that. So with that being said, Mr. Rise, Ms. Drescher, any last sentiments before we close up for this evening?
Just wanted to share again, please feel free to reach out with questions. It helps us guide what our conversations are for the town halls when we get questions in advance. It also allows us to, throw our questions towards those people with the expertise. So if folks have questions, please continue to submit those, and we will do what we can to come as prepared as possible.
Thank you. What's about Jody?
I think we'll just let them know that we'll share some information about homecoming. That's 2 weeks away, but we'll also make sure that we have that out to families and kids.
Yeah, a lot of events coming up. So how we handle that, how we navigate those situations safely is going to be very important. So thanks for that, Jody. Again, thank you, Leslie, for joining us. Thank you, everyone, for coming to these town halls. We will notify the public if we are going to continue town hall meetings, or if we move these to more of a pushing out information rather than a Zoom webinar. So we'll talk about that. We'll notify everyone early next week as to how we'll move forward with these information sessions. I do also want to again let you know that we are searching for folks that can help us with substitutes. So if you know anybody out there in the education world, or anyone that qualifies, we will continue to need substitutes as we go through this, just as we have to quarantine some of our kiddos and families, some of our adults as well. And when we do that, we want to make sure that we have adequate, not just adequate supervision, but high quality delivery of your academic education in the cases where we have a few of our teachers out. So that's a quick plug and a reach out to our community. Call us, reach out, stop by. Again, we really appreciate everyone for all that they're doing. And together we'll definitely get through this. So have a great evening. Look forward to seeing everybody again. Take care.